All right, here's a great little question. 73-year-old woman presents with bilateral shoulder and hip stiffness. Very important that you note stiffness, not weakness. She has difficulty raising her arms to brush her hair and get out of the bed in the morning. She denies muscle weakness. No muscle weakness, very important. But she notes that the stiffness improves as the day progresses. Okay, she has experienced mild fatigue and unintentional weight loss, and there is limited range of motion in her shoulders and hips due to the pain, but no muscle tenderness. Very important, no muscle tenderness. And there is elevated inflammatory markers like ESR and CRP, but there's normal creatine kinase. So a lot of things going on here. Okay, so polymyositis and dermatomyositis, these are both going to be muscle involvement disorders, and so those are probably not our answer. The answer is indeed polymyalgia rheumatica. Rheumatoid arthritis would present with like actual swelling of these joints, and it's not fibromyalgia. We'll talk about that in a second. So let's recognize these features of the disease she has, polymyalgia rheumatica. So proximal muscle weakness in the shoulders, hips, and the neck in the morning. No true muscle weakness, very important. Active movements, but no joint swelling. Systemic symptoms, malaise, weight loss, fatigue. Elevated inflammatory markers, but normal CK, and a strong association with giant cell arthritis, so headaches, jaw claudication, and vision changes. Symptoms improve with prednisone, so low-dose glucocorticoids. So polymyositis, that causes proximal muscle weakness when you're like lifting things, and CK is going to be elevated for both of these because those are going to be muscle inflammatory markers, but CK is not elevated in our answer choice, right? CK with polymyalgia rheumatica is not going to be elevated, but it is with polymyositis and dermatomyositis. Fibromyalgia, why is it not that one? That would cause widespread musculoskeletal pain, fatigue, cognitive disturbances, but importantly, this does not elevate these markers ESR and CRP. And it does not selectively affect the shoulders and the hips. So it's not inflammatory. You're not going to get that widespread kind of inflammatory markers for ESR and CRP. Rheumatoid arthritis would be the small joints in the hands and the feet. So they're going to be swelling and inflamed. And we didn't see that, so it's not rheumatoid arthritis. Okay, so bilateral shoulder and hip stiffness without weakness and morning symptoms and elevated ESR and CRP, but normal CK tells us that it's polymyalgia rheumatica, inflammatory disorder that responds well to low-dose corticosteroids. If this was helpful, then like and subscribe.